Glossophobia isn't a dangerous disease or chronic condition. It's the medical term for the fear of public speaking. For those affected, speaking in front of a group can trigger feelings of discomfort and anxiety. With this can come uncomfortable trembling, sweating, and a racing heartbeat. You may also have an overwhelming urge to run out of the room or away from the situation that is causing you stress. Glassophobia is a social phobia or a social anxiety disorder. Anxiety disorders go beyond occasional worrying or nervousness. They cause strong fears that are out of proportion to what you are experiencing or thinking about. Anxiety disorders often get worse over time, and they can interfere with your ability to function under some circumstances. When faced with having to give a presentation, many people experience the classic fight or flight response. This is the body's way of preparing to defend itself against perceived threats. When threatened, your brain prompts the release of adrenaline and steroids. This causes your blood sugar levels or energy levels to increase, and your blood pressure and heart rate rise, sending more blood flow to your muscles. Although the fight or flight response worked well when humans had to fear enemy attacks and wild animals, it isn't effective in a meeting room. Getting to the root of your fear may help you to take effective steps to manage it. Many people who have a strong fear of public speaking fear being judged, embarrassed, or rejected. They may have had an unpleasant experience, like having given a report in class that didn't go well, or they are being asked to perform on the spot with no preparation. Though social phobias often run in families, the science behind this isn't understood. A 2002 study reported that breeding mice that show less fear and anxiety resulted in offspring with less anxiety. But more research is needed to assess whether social phobias are hereditary. Many people are able to overcome their Glassophobia with cognitive behavioral therapy. Working with a therapist can help you identify the root cause of your anxiety. For example, you may discover that you fear ridicule rather than speaking because you were mocked as a child. Together, you and your therapist will explore your fears and negative thoughts that go with them. Your therapist can teach you ways to reshape any negative thoughts. If therapy doesn't relieve your symptoms, your doctor may prescribe one of the several medications used to treat anxiety disorders. If your anxiety is severe and affecting your daily life, your doctor may prescribe benzodiazepines like Ativan or Xanax. There are some strategies that you can use in combination with traditional treatment or on their own. For example, you might find it beneficial to take a public speaking class or workshop. Many are developed for people who have glossophobia. If you enjoyed this video, subscribe, like, share, and comment.